Okay, let's unpack this. The journey of bringing new life into the world is, well, it's an experience unlike any other, isn't it?
Absolutely.
Filled with both incredible wonder and, let's be honest, a flurry of questions.
Mm-hmm.
And at just 10 weeks pregnant, things are already transforming at an astonishing rate for both the baby and the expectant parent.
That's right. It's a really dynamic time.
Today, we're taking a deep dive into a comprehensive, medically reviewed source that lays out, well, pretty much everything you need to know about what's happening when you're 10 weeks pregnant.
Yeah.
Our mission is to distill these insights, giving you surprising facts and, practical guidance without all the information overload. Basically, a shortcut to being well-informed about this pivotal stage.
And what's truly fascinating here, I think, is the dual narrative we'll be exploring.
Okay.
You've got the rapid, intricate development unfolding inside the baby, and then the significant, sometimes surprising changes happening for the expectant parent, kind of simultaneously.
Right. Two parallel stories.
Exactly. And we'll connect those dots, helping you understand not just what's happening in week 10, but the profound biological reasons why it matters in the bigger picture of a healthy pregnancy.
So consider this deep dive your ultimate guide to this 10-week mark. We're going to get into the astonishing details of baby's development, those foundational architectural shifts happening microscopically.
Mm-hmm.
Then we'll pivot to what you, as the expectant parent, might be experiencing. Common symptoms, your body's incredible adaptations.
And all those changes.
Yeah. And finally, we'll move on to some essential practical checklists, helping you sort of strategically prepare for what's coming.
Planning ahead.
Our goal is clarity, actionable insights, all drawn directly from our trusted source. So let's get right into the incredible world of week 10.
Sounds good.
What's particularly compelling here is how, at just 10 weeks, the tiny life growing inside is undergoing this truly astonishing transformation.
It really is.
It's like a high-speed construction project, meticulously laying down the foundation for so much to come. When you consider the microscopic scale we're talking about, the sheer pace and precision is just mind-blowing.
Indeed. And if we connect this to the bigger picture, biologically speaking, this is a critical phase. Organogenesis, early structural development, it's all happening now.
Organogenesis, that's organ formation, right?
Exactly. The precision and speed with which these systems are forming are, well, a profound testament to biological complexity. It's an incredibly dynamic period where the fundamental architecture for a human being is rapidly taking shape.
Wow.
Every single day brings new, intricate connections and structures into being. It's setting the stage for all future growth and function.
And when we talk about scale, our source gives this fantastic analogy. At 10 weeks, your baby is roughly the size of a strawberry. It really makes you pause, doesn't it? Trying to visualize that tiny fruit, but knowing this entire human blueprint is being laid down. It's astounding.
It is.
A reminder of the incredible complexity hidden within something so seemingly small. And to get even more precise, the measurements provided state the baby is about 1.22 inches from head to bottom.
Tiny.
And weighs around 1.23 ounces.
Barely anything.
But these numbers, while incredibly small, represent monumental growth from just a few weeks prior. It's a testament to the density of development happening in such a compact form.
It truly is profound development in such a compact form. The rate of cellular differentiation and organization during this period is just phenomenal. It's establishing the groundwork for future functionality, even if the scale is still miniature.
Right.
This early rapid growth is crucial because it sets the trajectory for the whole gestational period.
Yeah.
Any significant deviations during this precise window could have lasting impacts. That's why the body's internal clock for development is so meticulously programmed.
Wow, okay. So beyond just the overall size, let's talk about sensory organ formation, particularly eyes and ears. This is where the details get, well, astonishing.
Yeah, this is fascinating.
Our source tells us that by 10 weeks, the primary components of the eye, we're talking the cornea, iris, pupil, lens, and retina, are already fully formed.
Fully formed. At 10 weeks.
It's quite remarkable, isn't it? The entire visual apparatus is essentially built.
And this early formation isn't just a cool fact. It's a profound insight into evolutionary efficiency. Biological foresight, really.
How so?
Well, think about the energy conservation. By getting these foundational elements, like the eyes, in place so early, the body optimizes its resources.
Oh, okay.
Later in pregnancy, when growth is really rapid, it doesn't have to expend massive energy building complex new structures from scratch. It can focus on refinement, increasing size.
Makes sense.
These structures are basically ready to go, just waiting for the right moment to fully activate and start processing visual information much later on. It's a remarkable testament to the deep inherent programming that underpins human development, ensuring readiness long before functionality is needed.
Wow. Ready but waiting. And despite being fully formed, there's this fascinating nuance. The eyelids are actually fused shut at this stage.
Wait, sealed tight.
And they'll stay that way until much later, around 27 weeks, the source says.
Yeah, quite a ways off still.
So the eyes are built, but they're currently under wraps, preparing for their big reveal.
Exactly.
Beyond the eyes, the source also notes that the ears, nostrils, and a tiny mouth are now visibly distinct on the baby's face.
You can start to see those facial features taking shape.
Yeah, the basic features are becoming quite well defined, even this early.
Mm-hmm.
So beyond these sensory developments, what else is rapidly forming that lays groundwork for later function?
Well, we also see the very beginnings of skeletal and dental development.
Teeth already?
Yes, teeth. Your baby's teeth are already starting to harden and connect to the jawbone at 10 weeks.
That's incredible.
Now, don't expect a toothy grin right after birth.
Right, okay.
Our source clarifies that while these structures are forming now, most babies don't sprout their first tooth until they're 6 to 10 months old.
Okay, that sounds more typical.
Though there are a few rare cases where a baby might be born with a tooth or two, or develop them unusually early. But that's rare.
It really makes you ponder the biological efficiency of forming these vital structures so far in advance.
It's an investment in future capabilities.
Yeah, ensuring that when the time comes for chewing or even vocalization, the underlying framework is robust and ready. It's like forward planning within the biological system.
Exactly. The foundations for future biting and chewing are being laid down nearly half a year before they're actually needed.
Amazing.
And perhaps one of the most exciting developments is happening in the brain.
Okay.
At 10 weeks, your baby's forehead temporarily bulges. It looks a bit prominent.
Right, I've heard about that.
That's to accommodate the rapidly developing brain. In fact, the head accounts for almost half of the baby's total length at this stage.
Half the length. Wow.
Yeah, it gives them a rather top-heavy appearance, temporarily, of course.
So this early rapid brain development, what does it signify?
It signifies the fundamental architecture for future cognitive and motor skills.
Yeah.
It's the essential groundwork being laid down.
The groundwork.
And simultaneously, crucial things are happening within the baby's spinal cord. Synapses are forming.
That's a profound thought, the fundamental architecture. Could you elaborate a bit more on what that really means at such an early stage? Are we talking the very first neural pathways?
Absolutely. We're talking about the genesis of the central nervous system itself.
Mm-hmm.
The neural tube, which forms the brain and spinal cord, has closed, and now we're seeing rapid neurogenesis, new nerve cells being created, and neuronal migration.
Migration?
Yeah, the cells are moving to form specific brain regions. And these early synapses, the junctions where neurons communicate, they're crucial. This isn't just about primitive reflexes. It's the genesis of complex neural networks. At 10 weeks, the brain is rapidly differentiating into its major regions, forebrain, midbrain, hindbrain, and these synaptic connections are laying the groundwork for everything from basic motor control to future cognitive functions, even before the structures are fully mature.
It's incredible to think that even though you can't feel it yet, such fundamental neurological connections are already forming.
Right.
This is the very beginning of discernible, albeit involuntary, movement. The nervous system is starting to connect the dots, sending signals.
Signals that will eventually lead to those first kicks you'll feel.
Exactly, and eventually purposeful actions. It's truly the dawn of independent motion, even if it's still totally imperceptible from the outside.
Precisely.
So beyond these incredible developmental milestones, the 10-week mark also brings some early medical insights and opportunities for reassurance.
Yes, important ones.
One of the most profoundly moving experiences for many parents-to-be is hearing the baby's heartbeat for the very first time.
Oh, absolutely. It's truly an emotional landmark. It makes it all feel so real for many people.
Yeah.
During your prenatal visit, it might be possible for your healthcare provider to use a fetal Doppler. That's a small handheld ultrasound device to pick up the baby's heartbeat.
And the sound.
The sound is incredibly distinctive, much faster than an adult heartbeat, often described as akin to galloping horses.
Galloping horses, I love that description.
This rapid pace, usually between 120 and 160 beats per minute, signifies the incredible work the baby's developing circulatory system is already doing. pumping oxygenated blood rapidly throughout its tiny body.
So that speed indicates healthy function.
Yes, healthy cardiac function and robust blood flow.
And our source even suggests you might want to take your phone out and record it.
Why not?
Imagine having that unique galloping sound to listen to whenever you want. Such a tangible connection.
It really is.
Another significant medical insight available around 10 weeks is non-invasive prenatal testing, or NIPT.
Right, the NIPT. This test is a significant leap in prenatal care. It offers early insights with minimal invasiveness. It's just a blood test taken from the expectant parent.
Just a blood test? How does that work?
It works by analyzing small fragments of the baby's DNA that naturally circulate in the parent's bloodstream.
Wow.
It screens for certain chromosomal conditions like Down syndrome, Edwards syndrome, Patel syndrome, and also looks at sex chromosome abnormalities.
And crucially,
as part of the analysis, it can also reveal the baby's gender.
That's a really good point, and one that weighs heavily on many parents. What are some of the common considerations parents often grapple with when deciding whether or not to receive this kind of early information, especially the gender?
Oh, there are many factors, and it's deeply personal. Some parents feel empowered by knowing early. It helps them prepare emotionally, research specific conditions if a risk is indicated, maybe adjust birth plans.
Right, preparation.
Early knowledge can foster a deeper connection, make it feel more real. But others prefer the surprise. Or they worry that early information, especially about potential risks, might just cause undue anxiety.
Yeah, I can see that.
They might feel it diminishes the sort of organic unfolding of the journey. There's really no right or wrong answer. It comes down to individual comfort, philosophy.
Which is why it's critical, if you prefer not to find out the baby's gender, you have to tell your healthcare provider clearly before the test.
Absolutely. Make your preference known. It's entirely your choice.
And while we're on early medical checks, the first ultrasound is also becoming more common in the first trimester.
Yes, more and more doctors are doing ultrasounds as early as 6 to 10 weeks now.
Is it routine?
Not universally routine, but a provider might recommend one early if there's a history of previous complications like miscarriage or ectopic pregnancy, or maybe just to confirm viability and get accurate dating.
Especially if cycles are irregular.
Exactly. An early ultrasound gives a more accurate due date then.
Yeah.
And at this stage, because the baby is so small and deep in the pelvis, it'll most likely be a transvaginal ultrasound.
Okay. Explain that.
It involves a small probe inserted into the vagina. It gives a much clearer, closer view of the tiny developing structures compared to an abdominal one at this stage. Allows for precise measurements, visualization of the gestational sac, yolk sac, fetal pole.
Got it. Clearer picture early on.
Right.
So we've explored this incredible, intricate world developing within. It's truly a marvel, all that's happening inside that tiny strawberry-sized being.
It really is awe-inspiring.
But of course, these incredible internal orchestrations don't happen in isolation. For the expectant parent, the 10-week mark often brings its own set of significant and sometimes challenging transformations.
Yes, the body is working hard too.
It's almost as if the body is recalibrating every single system to support this new life. Let's pivot now to what you might be experiencing. While that tiny, rapidly developing being is progressing at this astonishing rate, your body is also undergoing a profound series of physiological adaptations.
Absolutely.
And these aren't just subtle shifts. They can be quite impactful, often prompting a complete wardrobe change much sooner than you might expect.
Yes, the clothes start feeling tight.
It's a remarkable period of transformation impacting nearly every system.
It's a profound testament to the body's innate ability to adapt and nurture new life. These changes, while sometimes uncomfortable, are all geared towards supporting the growing baby and preparing for the journey ahead.
Understanding the why can help, right?
Definitely. It can demystify the experience and provide some reassurance.
Okay, let's talk about maybe the most visible sign for many: belly changes and weight gain. At 10 weeks, you might start to notice a thickening in your midsection, maybe a rounder belly, especially if this isn't your first pregnancy, the source says.
Right, your abdominal muscles might be a bit more relaxed, or if you're expecting multiples, that obviously contributes. The body kind of remembers what to do and sometimes shows a little sooner.
However, and this is important, it's completely normal to not be showing at this point, to see no discernible difference.
Absolutely normal. Bump size depends on so many factors: your body type, muscle tone, the position of your uterus.
Tilted forward or backward, right?
Exactly. And even things like bloating, which can be significant in early pregnancy.
So lots of variation.
A wide spectrum of normal. No need for concern if you're not seeing a bump yet. Everybody is different. every pregnancy unique.
And regarding weight gain, our source points to expert recommendations of gaining about 1 to 5 pounds in the first trimester.
That's the general guideline.
But again, individual weight gain can vary quite a bit.
It really can.
Which often means you're in that awkward phase between regular and maternity clothes.
The in-between stage.
Yeah, not quite ready for full maternity wear, but your regular clothes are feeling snug. The source suggests stretchy waistbands become absolute must-haves. And there are clever hacks, like using a hair tie on your button fly.
Oh yeah, the hair tie trick. A lifesaver. It's all about comfort at this stage, adapting as your body adapts.
Okay, so beyond the belly, your circulatory system is undergoing massive adjustments.
Huge adjustments.
You might start noticing newly visible blue, prominent veins across your chest, breasts, belly.
Yes, becoming more noticeable.
And this isn't just cosmetic, right? There's a significant physiological reason.
Absolutely. What's truly fascinating here is the sheer scale of adaptation. The cardiovascular system undergoes profound remodeling. It's not just expanding highways. It's significantly increasing cardiac output and blood volume.
How much more blood?
Up to 50% more blood by mid-pregnancy. And that increase starts now, in the first trimester.
50%. Wow.
This remarkable increase ensures adequate perfusion of the placenta, the baby's life support delivering oxygen and nutrients. And it supports the increased metabolic demands of the mother's own organs.
So the veins pop out because
They become more prominent because they're working harder to handle this increased volume. They get engorged and more visible through the skin.
that's a powerful picture of your body's commitment. And along with these visible veins, some people might also develop varicose veins, mostly in the legs.
Yes, that can happen. It's due to the increased blood volume, plus the growing uterus putting pressure on pelvic veins, and hormonal changes progesterone relaxes vessel walls. All that can lead to blood pooling in the legs.
But there's good news.
The good news is they often disappear or significantly improve after giving birth, as your circulatory system gradually returns to its pre-pregnancy state.
Okay, good to know. Now, this increased blood volume, while vital, can also lead to other symptoms like dizziness, lightheadedness.
Yes, that's common too. Your cardiovascular system is working harder, and sometimes blood flow to the brain might not adjust quickly enough, especially when you change positions.
Standing up too fast.
Exactly. That can cause that fleeting sensation of dizziness or lightheadedness. It's often called orthostatic hypotension.
So what should you do if that happens?
The critical advice is to sit or lie down right away. If possible, put your head between your knees to encourage blood flow to the brain.
Okay.
Also, try to avoid standing for long periods, especially in warm places, and stay really well hydrated.
Even if you're driving.
If you're driving, immediately pull over and stop the car until you feel completely better. Safety first, always.
Absolutely. Okay, shifting gears slightly. Let's talk about some common but maybe unexpected secretions.
Yes, the less glamorous side, perhaps.
One of these is excess saliva, also known as ptyalism.
Ptyalism, yes.
Many people are quite surprised by this one. You might find yourself salivating more than usual, especially when feeling nauseated.
It happens. It's a common and completely normal symptom of early pregnancy, particularly in the first trimester.
Any idea why?
The exact cause isn't fully understood, but it's thought to be linked to hormonal changes, especially estrogen, and it often accompanies severe morning sickness. Maybe the body produces more saliva to counteract stomach acid, or maybe you're just trying to avoid swallowing when you feel sick.
Okay, so how do you manage it? The source has tips.
Yes, if you can't swallow the excess saliva, spitting it out into a tissue or cup is an option.
Okay.
Also, drinking more water helps. Chewing gum, especially sugar-free mint gum, or sucking on hard candy or lemon drops can help you swallow it more easily, stimulate normal swallowing, and just provide a distraction. Makes it a bit more manageable.
Good tips. Another very common secretion, increased vaginal discharge.
Yes, leukorrhea.
You're not imagining it. Your body really is producing more due to higher estrogen levels, increased blood flow to the pelvic area.
Stimulating the mucous membrane.
Right. And healthy discharge is typically odorless or mild smelling, and milky white and thin.
Correct. That's normal leukorrhea, and it actually helps protect against infection.
But it's crucial to know when discharge might signal an issue. The source outlines red flags.
Yes, definitely. Contact your healthcare provider if you see a sudden change in the type, like continuous leaking fluid that could be amniotic fluid.
Okay, important.
Or if it smells strong or unpleasant, which might indicate a bacterial infection. Or if the color changes to gray, yellow, or green.
What could those colors mean?
Various infections like bacterial vaginosis, trichomoniasis, or a yeast infection. any of those changes warrant a call to your provider. Vigilance is important.
Absolutely. Okay, beyond the physical, pregnancy is also a profound emotional and hormonal roller coaster.
Oh, absolutely.
Mood swings are incredibly common at 10 weeks. You might feel incredible elation one minute and then unexpected sadness or irritability the next.
Within minutes sometimes.
Yeah.
And this really raises that question about the interconnectedness of physical and mental well-being during pregnancy, doesn't it?
It really does.
These mood swings are normal. They're influenced by stress, fatigue, and those dramatic hormonal changes, estrogen, progesterone affecting neurotransmitters in your brain, like serotonin and dopamine, which regulate mood.
So hormones are a big part of it.
A huge part. And, of course, just the profound feelings about becoming a parent. Immense joy, but also apprehension about the huge life changes ahead. That all contributes to the emotional landscape.
So it's normal, but when should you seek help?
That's the critical point. Recognizing these shifts as normal, but also knowing when to reach out. If negative feelings like profound sadness, hopelessness, losing interest in things you enjoy persist for more than 2 weeks, talk to your healthcare provider. Ask for help.
It could be something more serious.
It could be signs of pregnancy, depression, or anxiety, which are more common than people realize. Please don't hesitate to seek support. There are effective treatments available.
Really important message. And finally, a big one for many. Morning sickness.
Ugh, morning sickness.
If you're battling nausea and vomiting, you are definitely not alone. Our source states it often peaks right around 9 or 10 weeks.
Right at this point for many people.
For those battling it, knowing it peaks now is crucial. I've heard it described as trying to navigate life perpetually seasick.
It can feel like that. So knowing there might be a light at the end of the tunnel can be immensely comforting.
So why does it peak now?
Understanding the why can offer some peace. It often peaks around 9 or 10 weeks, precisely because this is when levels of the pregnancy hormone HCG, human chorionic gonadotropin, are at their absolute highest.
Ah, the HCG hormone?
While the exact mechanism is still being researched, HCG is believed to directly stimulate the part of the brain that controls nausea and vomiting. Plus, high estrogen levels can slow down your stomach emptying, adding to that queasy feeling.
So it's a potent hormonal cocktail.
Unfortunately, yes, manifesting as morning sickness.
But there is a light at the end of the tunnel.
There really is. The good news is that HCG levels typically start to fall around 11 weeks. They drop about 50% from their peak by 15 weeks.
Okay, that's significant.
Which is why many expecting parents find significant relief from morning sickness early in the second trimester, often feeling much better by week 14 or 15.
So hang in there if you're in the thick of it now.
Exactly. Understanding the why and knowing when to expect relief can make a huge difference in coping.
Absolutely. So, with the physical and emotional landscape of 10 weeks becoming clearer, it's time to ground ourselves in the practical stuff.
Right, the planning aspect.
The 10-week mark isn't just about experiencing changes. It's a prime time for strategic preparation. What should be on your checklist this week?
Well, laying that strong foundation is key.
And that goes beyond the immediate physical changes. This is where proactive planning really comes into play, ensuring you're ready for the shifts ahead.
And comprehensive financial planning is a cornerstone of preparing for parenthood. It's about anticipating needs, securing the family's future, often overlooked, but so critical.
Yeah, a new baby typically means a new budget, right? Increased expenses people might not even think about yet, diapers, formula, childcare, maybe needing more space.
It all adds up.
So our source strongly advises reviewing your finances right now. And this is more than just everyday spending. It means considering the impact on income if one parent stays home, even for parental leave.
Understanding leave policies is crucial. Maternity, paternity, FMLA.
Or how you'll manage if you're self-employed. And it's also a great time to look into life and/or disability insurance.
Yes, important safety nets. Life insurance provides for dependents, and disability insurance replaces income if you can't work due to illness or injury, including pregnancy complications.
Furthermore, having a will in place seems morbid, maybe, but it's paramount.
Absolutely paramount. It allows you to name a legal guardian for your child if the unthinkable happens to both parents. Without a will, the courts decide, and that might not align with your wishes.
Good point. And it ensures assets are distributed as you prefer. Peace of mind.
Exactly. Knowing your child's future is secure.
And let's not forget taxes. A baby changes everything, including your tax situation.
Yes, taxes too.
It's wise to consider how the baby will affect your taxes. Once born, they're a dependent, making you eligible for the child tax credit.
Which is a significant benefit.
Yeah, and maybe credits for childcare expenses. Consulting a tax professional or reviewing IRS guidelines is a good idea. Adjusting your W-4. Planning now saves headaches later.
Definitely proactive steps.
Okay, moving beyond finances, prioritizing health and wellness for the expectant parent. Our source highlights a fantastic option, prenatal yoga.
Oh, I love prenatal yoga. It offers a wonderful blend of physical and mental benefits, specifically designed for a changing pregnant body.
How is it specifically tailored?
It focuses on gentle stretching to alleviate common discomforts like back pain. It strengthens core muscles and the pelvic floor, preparing for labor. And it cultivates breath awareness techniques incredibly valuable during childbirth.
So physical benefits, but also mental.
Absolutely. It deeply engages the mind and spirit, promoting relaxation, stress reduction through mindfulness, meditation. It prepares you for labor, birth, even early parenting by fostering mental resilience and calm.
And you can find classes online or in person.
Yes. And the source notes that in-person classes offer that valuable built-in community, a chance to connect with others on the same journey, share experiences, build support.
Yeah, that community aspect sounds great. Really holistic benefits.
Definitely.
Now, for those still grappling with morning sickness, which, as we said, can peek around now, the source gives practical strategies, actionable daily tips.
Yes, things you can try right away. Dietary adjustments can make a big difference. The recommendation: 5 or 6 small meals a day, not 3 large ones.
Keep the stomach from getting empty.
Exactly. An empty stomach often worsens nausea. Focus on bland, easily digestible foods. And prioritize cold foods. They often have less potent smells than hot aromatic dishes.
Smells can be big triggers.
Huge triggers. So have someone else prepare food if possible, or opt for takeout or ready-to-eat options.
Yeah.
Even simple things like keeping crackers by your bedside to eat before getting up can help.
And importantly, the source says you can ask your provider about safe medications.
Yes. Don't suffer in silence. There are anti-nausea meds, vitamin B6 supplements. Your doctor might recommend options that are safe during pregnancy and can provide significant relief. Always discuss these with your medical professional.
Good advice. Another critical health point. Urinary tract infections, or UTIs, the source says they're more common during pregnancy.
Yes, they are. So it's absolutely essential to know the signs and act quickly.
Why are they more common?
It raises that question about proactive self-monitoring, doesn't it?
Yeah.
UTIs are more common because hormonal changes can relax the urinary tract muscles, and the growing uterus can press on the bladder, making it harder to empty completely. That allows bacteria to grow.
Ah, okay. So being aware of symptoms is key.
Crucial. It allows for early intervention, prevents potential complications, your body is communicating with you, key symptoms to watch for, pain or burning when urinating or during sex, pelvic discomfort or lower abdominal pain, a frequent urge to pee even when little comes out, or cloudy and foul-smelling urine.
And if you have those symptoms,
contact your caregiver promptly. Untreated UTIs can sometimes lead to kidney infections or even premature labor. But the good news is, a short course of antibiotics prescribed by your doctor will typically clear it up safely during pregnancy.
And good to know it's treatable. Finally, let's talk about one of the most exciting yet personal decisions, navigating the pregnancy announcement.
The big reveal.
The source strongly emphasizes the timing is a deeply personal choice. Completely up to you, no right or wrong time.
Absolutely. It's layered with personal, professional, emotional factors. A common approach is telling loved ones, first partner, family, close friends, then waiting longer for work or a broader circle.
A phased approach.
Yeah, it lets you control the narrative, gauge reactions, process your own emotions. Some wait until after the first trimester when miscarriage risk drops significantly for that added security.
Makes sense. It's a truly exciting moment for many sharing your news. And the source highlights that you control this narrative. What about telling your employer?
There's no specific rule or law on when you have to tell your boss. However, letting them know within a reasonable window of time can be beneficial for everyone. It allows more time to plan for your maternity leave, ensuring a smoother transition.
Planning coverage, discussing leave like FMLA?
Exactly. Discussing benefits, planning coverage during your absence. It's a balance of personal comfort and practical planning, aiming for transparency when it feels right for you.
Okay. And just to briefly circle back to body changes, the source reiterates that at 10 weeks, some might see a rounder belly, especially with later pregnancies or multiples. Yep. But it's also completely normal if you're not showing it all. Bump size, or lack thereof, depends on so many things: body type, muscle tone, uterus position.
So much variation.
And while experts recommend 1 to 5 pounds weight gain in the first trimester, individual experiences vary widely.
Based on pre-pregnancy, BMI, and other factors, it's fluid.
All variations are perfectly normal. Everyone's journey is unique. Always consult your provider for personalized guidance on weight gain.
It's good advice.
So we've truly taken a comprehensive deep dive into what happens at 10 weeks pregnant.
We covered a lot.
Yeah. From that strawberry-sized marvel, rapidly forming senses, skeleton, beginnings of movement, brain function, to your body's incredible adaptations, diverse symptoms, the emotional roller coaster,
And the practical side, too.
and the practical checklists, financial prep, wellness, navigating announcements. It's an incredible amount of transformation and growth in such a short time for the baby and for you.
And knowledge is most valuable when understood and applied, right?
Yeah.
This deep dive should leave you feeling equipped with a clearer, more nuanced picture of this pivotal stage.
More understanding, more confidence.
Exactly. Allowing you to approach it with greater understanding and confidence. Knowing what to expect and why empowers you to navigate this journey with more intention, less anxiety, and a deeper appreciation for the intricate processes at play.
Okay, so here's where it gets really interesting. Final thought. Considering the sheer complexity and speed of development in these initial weeks, and how perfectly synchronized the baby's growth is with the parent's body, changes from the earliest organ formation to the massive blood volume adjustments. What does this synchronized, unseen biological dance make you ponder about the fundamental blueprints of life itself, and the incredible, often unnoticed resilience and adaptability that unfolds within us from the very beginning?
That prompts a fascinating reflection, doesn't it? In an era of abundant information, how does a focused deep dive like this, in the very earliest stages of human life, revealing such intricate pre-programmed development and profound maternal adaptation, how does that enhance our appreciation for the delicate yet powerful dance of biology? And perhaps even reshape our understanding of what it truly means to nurture life right from its nascent beginnings?